Awesome.
Also,
So
need to
thanks
share the
everybody
screen.
for joining. And yeah, over to you guys.
Thank
You need to permit me to share the screen.
Yeah. So
Yeah.
as Dr. Praveena shares the screen, let me just set the tone for what's going to be the agenda for the next 56 odd minutes. So our aim through today's session is to basically give you an insight into diabetes. Uh, Many of us know this as a disease, which is a disease that stays for life. We're going to break some common misconceptions about the term diabetes itself. For instance, a small teaser, do you know that diabetes is actually not even a disease? I'll let the expert, Dr. Praveena, throw some more light on that. But today is a great day because today is also Children's Day. And according to data of ICMR from the year 2022, in India, about 95,600 some odd of those who have diabetes are children. So almost about a lakh of children in India, and this is recorded data. Many more in the villages they have diabetes probably which is undetected. This is type 1 diabetes only, which is mostly genetic. So these figures are really worrisome, and the aim is to spread awareness to tell people that this is not something which one needs to be scared of, but to sort of understand and tackle and sort of heal it from the root itself. So, whatever is the root cause, we want you to understand that this is not something that you have to live with lifelong. Small steps on a daily basis can help you in sort of taking the steps towards achieving a larger goal, which is to be diabetes free. Dr. Praveena will be talking more about the, term diabetes, what all does it entail, how to beat it, really, because that is something we feel that now we should be talking about it, because I'm sure everybody has somebody in their family who has type 2 diabetes or type 1 diabetes. And it'll be great if as Pinkasha suggested, if we can start with one poll right away to give Dr. Praveena some sort of view of what kind of audience we have. And also I would request our participants to keep sending us questions on the chat window, and we'll be happy to take those questions at the end of the session. With that, it's over to you. Dr. Praveena, please go ahead.
Thank you, Sana.
So I've
Yes,
run a quick
the poll
poll
is on.
in the past. Are you diabetic? Yeah, please go ahead, guys, and answer.
It's wonderful. We have been getting good responses. Good.
Okay. I think
Yes.
most of us
Very
don't.
good people. Yes. Good percentage of polling we have achieved.
Yeah.
Yes. So we can proceed with our sessions, and I'll let you know with the next poll.
Yes, please. Thank you so much.
Thank you, Sana, for the introduction. So, as Sana rightly mentioned, and it is World Diabetes Day. So, these days of healthcare awareness, I think, for the past 4 5 years, been celebrated in every angle, right from cancer to cardiac health. And today we are at the World Diabetes Day, very much associated with our Children's Day. Let's all have our little child always active within us. So, being very active like a child is so important as we discuss this topic for the next 40 minutes. So let me tell you why this World Diabetes Day celebrated on November 14th. So insulin, I hope most of you would have heard this word called as insulin, which is very much there within all of our body, right? So this insulin was invented by Sir Frederick. So this is his birthday. So the world, we are trying to celebrate this World Diabetes Day on honoring the inventor of insulin, Mr. Frederick, on his birthday. Yes, that's a simple note. Why on this day? Now, why should we celebrate? Like how we create awareness about breast cancer, cervical cancer, and all that. Similarly, this day and for the next 1 year, we from the medical fraternity, we kind of create awareness to people about diabetes and management. Like we have certain organizations like ADA, American Diabetic Association, International Diabetes Federation. They create a theme throughout the year to run. So this year theme is about diabetes and well-being. All of us are living, there are people who are living with diabetes. Now, are they having a great life along with diabetic? So being happy mentally, physically, health-wise, all that is so important. So this year message is about diabetes people living happily and healthy. So this is a message globally, every medical fraternity would follow. Yes, that's a small introduction about World Diabetes Day. Now coming to the serious topic, or maybe a eye-opening topic that we all should have a understanding. So if you could see here, this is a data that comes up telling about the prevalence of certain complications or chronic conditions that's been running. Let me make it very simple. High dyslipidemia is simple, a high cholesterol level. For your understanding, it's a cholesterol level. 81% of the total population in India are suffering with cholesterol levels, high cholesterol levels. That's a really a shocking number. Obesity, people with overweight category, 40% of us are in the obesity category. 36% in overall population have hypertension, that is blood pressure. 15% are pre-diabetes, 11% are diabetic in the overall population, which is a huge number. You know what? India stands number 2 in diabetes in the whole world. That's not a great marker to talk loud, right? We have to be number 2 or number 1 in different heights of wealth or well-being. But number 2 in diabetes is seriously a strong message for the next generation to stay very preventive. Now we'll see about all that, how to get ourselves prevented and diagnosed. So this poll, which we conducted right now, I see an interesting factor where 33% of people have mentioned that I'm not sure whether I'm diabetic or not. You will get an answer here. So maybe a few years before or even now in any corporate sectors or any companies that we work, when the computer crashes, that's where we all, in the mid of a project that you are and a computer crashes, that worries us a lot, right? Now, than that, you know what the worry, being a healthcare professional that we are looking at, imagine the same scenario is happening for ourselves. We are all highly efficient, but badly burnt out, or our illness is not letting us to be very productive. So the computers are fit, the staffs are crushed. We have to address this. You know what? When we are crashed or when we are down, most of us looking for a friend. Any idea what is this friend about? Can I have a chat answer here? What is this friend? A corporate employee, a friend starts with C, ends with E, and has a middle word A. Any idea what is this? So let me break it here. It's a caffeine. Not sure how many of you are choosing that best friend in holding a cup in between your fingers and sipping it to boost you, to bring back to your speed, right? So caffeine, how does that affect? Now, then caffeine, there are many things that can support you in boosting. Let's see on all that. So during in our lifestyle, if you see, most of us are having these. I hope everyone will understand sedentary lifestyle. Slowly, it is evolving in every of our life. How many of you can guarantee or say, tell, I am very active than my mom at this age? If you're say 20s or 30s, when your mom was 30s, she was also very active than you. Even now, how many of you go back to your home and you sit at the sofa after your work and tell mom, can you get me a glass of water? So the parents are really a very active than us, right? So the sedentary lifestyle is slowly emerging into us without we realize it. Strain in the eyes. When you as you look at the system now, just close your eyes for a single second, you can see that little burning sensation, a dry eyes, a headache feel, a blurred vision that can come slight when you bend down and get up, a slight strain in your eyes. We all could feel that because overexposure to the digital lights can cause this. Stress level, I don't think there is a full stop for this. Everybody has one or the other stress level, right? If people living in Mumbai, Bangalore, even a red signal while coming to the office is a stress for us. Right. So we are in stress in different level that comes up, right? From simple things to to the complicated thing, the stress is having a great impact on our health, right from your health, physically as well as mentally. We have to be very, very careful in handling situations. As I spoke earlier about the risk that we have as an individual living with India, living in India, that's data which is for us, because you might ask, or you see, obesity rate is very high in US, but diabetes rate is very high in India and China, wherein we do not have a high obesity rate. I don't know. We are all very much blessed, or our genes are predisposed with this metabolic disorder. So that's also a reason that we have to be very, very careful in handling this. Again, let me come back to telling you why is this so important, and why is the reason that we have conducting these kind of sessions in corporate companies. Maybe as we were discussing, I started my career 2 decades ago. When I started, I used to tell people diabetes can occur above the age of 40, above the age of 50. But no more I could say that. Now, the diabetes is prevalence in the age between 20s and 30s, very young stage. You know what? I'm not talking about the children who developed diabetes, that is type 1 diabetes. I shall explain to you that. But even at the age of 8, children develop diabetes due to obesity, insulin resistance. This is a quite huge number that comes up, and it's an alarming number. Along with it, it's not only about the affecting of diabetes, it starts affecting our family, our lifestyle, our emotions, our physical well-being, our activeness, our productivity, everything gets affected. So above 40, people in the age of 40, you would have had a plan for your financial savings, your family and all that. But imagine the age of 20, where your focus has to be completely towards your career and growth, and there hampers a health along with it. It's an additional burden towards us. We should definitely wake up and start taking actions on the same. And this is being proven with the data. So what do you think that we have to bring a break that has to be taken for this? Is a simple habit change that we'll have to bring in our day-to-day actions. It's not that everything that we can change. Humanly not possible to change everything at a single point of time. A simple habit can change and make a big difference in our health. We're going to see what are the habits which you can change to bring back a great impact on your health, right? So your daily habits, maybe improving your overall health or your mental well-being, the small adjustments in your exercise pattern, sleep pattern, or maybe you're going to hitting your bed a little early, some things on your stress management, enhancing your mental health by spending more quality time with your loved ones can also help you. So, and these are the small lifestyle changes. I think these kind of words you've been hearing everywhere, any health article that you read, any doctors that you listen, any health related reels that you watch. These are all things that comes on your way. But how are we doing it on a daily basis? We listen. Are we implementing? That's the point that we are here to discuss about. Right? We all know we have to stay healthy. We have to eat healthy. We have to do regular physical activity and do some pranayams, meditations, and all that to reduce our stress and have an adequate sleep. But where are we lacking in doing all this? We have to understand and realize, right? Simple 30 minutes of daily exercise. You know what? When I started my career, I used to say 30 minutes of daily walk, alternative day is also good. But then over a period of time, my guidelines by the organization changed. 30 minutes, 4 times a week mandatory. You know what is the guidelines now? 1 hour, 7 days. That's the guideline that is currently there. Because these small steps are not helping us to overcome these lifestyle disorders. So the guidelines are keeping changing because equally our lifestyle is also going worsen and worsen. That's why the guidelines also keeping us pushing towards you have to do this. Now, what are I don't say it as an excuses, but there are certain things that we have a reason behind why we are not doing this. Maybe we are very resistant to make a change in our life. Time. That's a big point to all of us. We don't have time to do it. My work timing demands to be there, wherein I'm not able to spend time for myself. I have to spend time for my family, but I'm not able to spend time for myself. That's the main constraints that come into the way. Financial barriers, maybe picking up my gym subscription. Everybody thinks yes, financial barriers are there in terms of your spending amount on physical activity. It's not only about that. There are many things. Maybe a healthy fruits. I may recommend you should have a fruits on a daily basis, but two apples now cost is very high. So these are the many reasons that people can come up saying that these are not able to do it, but we will have to work. It's a reality. We have to understand on making this happen. Another major thing is awareness. What to do? Many things are giving me many informations. Google give me lots of information. ChatGPT gives me a lot of information. Insta influencers are giving me a lot of information. So my doctors, my parents, my siblings, my spouse, everybody gives a lot of information. But what is right? The awareness is very much lacking. We should also find a way personalized for you to deliver what is important for your health. That's becomes more important. We'll see how that can be achieved as well. The important aspect is sustainability. The new year is coming on the way. A lot of us takes resolution, but sustaining towards the second half of the year itself is a challenging aspect now. So we have to keep ourselves sustained on what we take changes is so important. Now coming to the main topic of today's discussion, the chronic disease, where we'll be focusing more about the diabetes. So what is chronic diseases? The disease that persists for more than 3 months or so, we call it as a chronic diseases. And no more you can call that as a disease. It's more of a disorder. It's called as a metabolic disorder that occurs on the way. So we will have to be very consciously understanding what is this disease, how to diagnose, and how do I prevent it, or how do I manage it, or how do I normalize or reverse it. All of us should be very aware about it. Now, can we run the second poll on who
Yes.
diabetes? Or yeah, I would urge participants to give a good response so that we can clear your myths. Do you believe diabetes is only caused by eating too much of sugar? The response poll is increased compared to the last one. Thank you for the participants to involving in this. Yes. Thank you so much. So do you believe diabetes is only caused by eating too much of sugars was a question, and a good response and a correct response, which is no, not necessary. It's not only caused by high sugars, eat consumption. There are multiple factors that are involved for an individual to develop the onset of diabetes. Let's look at the same. So diabetes is a chronic condition which affects our body and the sugar levels. It's like every one of us have sugar in our body. If you check your blood sugar, none of our sugars will be zero. We all have a sugar base level maintained in our body depending upon our health conditions and the actions of insulin, reactions of insulin. The levels of sugars varies. Now we should understand what is the normal value, what is the abnormal value when we monitor. But before that, let us slightly understand, take a minute to understand what are the different types of diabetes and what we should be concentrating on and what can be managed from our end. You should be very aware of. There are majorly three types of diabetes. One is type 1, second is type 2, and the third is gestational diabetes. Type 1 is something that is not preventable as of now. When I say it's not preventable, the simple reason is we don't know the cause of type 1. Multiple causes spoken. The children develop diabetes in a very young age. In the youngest I have treated or I have handled is 6 months old baby. The eldest type 1 I have handled is 63 years gentleman. So once an individual is type 1 diabetes, he will not turn into type 2 as he grows. Type 1 is a type 1 for a long time. When type 1 diabetes people will not have insulin production in their body. The pancreas, which is an organ responsible, all of us have an organ called pancreas, superb organ. It's a beautiful sensory organ. Our Almighty has created that organ. No engineers have a great, can create a sensory device like that. So this organ senses the high sugar levels and produces insulin. Unfortunately, this type 1 diabetes individual will not have a insulin production at all from the pancreas due to multiple reasons spoken, but we cannot say this is the cause. So these people have to be dependent on insulin from external to lead their life. Even a single day cannot run for them without insulin. They have to be dependent on insulin. Unfortunately, currently the insulin is available only in the form of injectables, no tablets or no insulin patches on inhalers. Many way they tried, but unfortunately the successful one, very safe one is insulin injectables, and they have to be dependent. That is why these people are called as insulin dependent diabetes mellitus. They have to be dependent on insulin throughout their life. And this can occur in any age group, especially younger onset. Lesser 20 years of age, they can occur. It's not like right from the birth they will have. No, they can develop in 10 years, 12 years, 15 years, any age they can develop type 1. It's a sudden onset. Immediately we'd be able to diagnose it, right? And it's not preventable. Let us understand. Now let's come to type 2, which is a major or say the larger group which is getting affected. 1 in 4 people in our group itself might be diabetic or a pre-diabetic. That's the stat that says. We are, like say, type 2 diabetes occur in the older age group above the age of 20. As I told you, I was telling 14 few years back, or say some years back. Now I'm telling you above the age of 20, anytime diabetes can occur. That's type 2 diabetes. And it's not that we have to be dependent on insulin injections from out. It can be diet and exercise can help in controlling the sugars, not like normalizing or reversing. It can help in controlling. Medicines can help. If both medicines, exercise, and diet is failing, they might also come to insulin injections on some days. Next comes the gestational diabetes. Gestation means pregnancy. A woman during the period of pregnancy, gestation, they might develop high sugar levels. That's called as gestational diabetes. So it's not that people with diabetic become pregnant is called as gestational diabetes. No, a normal individual during the period of gestation can develop high sugars. They are called as gestational diabetes. So women with overweight conceive, or women with a family history of diabetes conceive, or women with PCOD history conceives. Some reasons of say immediate weight gain during the pregnancy. These are all the cause of gestational diabetes. And both type 2 diabetes and gestational diabetes are preventable. We can work around before the conception, or once you develop diabetes during the period of gestation, it's very much possible for us to control and manage. Now, how do I know I have diabetes? You can know only when you test yourself. You should do a blood test, right? So the major diagnosis test, can you see something in the extreme right? That's HbA1c. This gives an exact value of what had happened in the last 3 months of your sugar levels on an average rating it gives you, right? So when it's not required to be done on a fasting or after food, nothing like that. Any time of the day, you can go give the blood sample near your lab. So when your HbA1c is below 5.7%, you are absolutely normal. If your HbA1c is between 5.7 to 6.4, which means you are in a high risk of developing diabetes. 5.6 to 5.7 to 6.4, high risk of developing diabetes, or you can call yourself, I'm a pre-diabetic. If your HbA1c is more than or equal to 6.5, you are confirmed to be a diabetic individual where you need immediate care and attention to normalize, to reverse it. Right? So understanding insulin as I was telling you, type 1 diabetes, this is the beautiful organ which I was talking about, the pancreas, which produces insulin. In type 1 diabetes, there is absolutely no production of insulin. So the glucose cannot enter into the cells to give us energy. In normal individual, the insulin is a key for us to open the gate and let the glucose in to give us energy. Why do we eat food? We need energy, right? But that action can happen only when this insulin function is properly done for you. Otherwise, it will not happen. Here you can see in type 2 diabetes, insulin is very much there, but the gate is not opening for the glucose to enter. The gate is closed. That condition is called as insulin resistance. So we will have to overcome enhance the insulin production and work on insulin resistance. To prevent us from diabetic as well as to reverse us from diabetic, we will have to do these actions. How? We will see that. Now, before testing, why should I go for testing? Should I go or not go is absolutely your understanding. But now, symptoms we will have to understand. Like people during summer, they think, I think due to excessive hot, I'm drinking more water. That's not true. So excessive thirst. Because I'm drinking more water, I'm going for frequent urination. People might think that way also. It's not that. When excessive sugar is there in our blood, our kidney is another beautiful organ. Excessive sugar, I need to eliminate it from the body to prevent my body or safeguard my body from complications. So what it does is it tends to push out the sugar from the blood. So on the process, the kidney keeps pushing out more fluid. That's why people pass more urine. As a reaction, people feel very thirsty, more of dehydration. Why do people have an unexplained fatigue, tiredness, all that? We eat food for energy. But ultimately, say for example, you are sitting in a room where you are hungry and you keep screaming, I'm hungry. Your mom or your loved one is keeping the food outside the door, but it has not reached you. You're still hungry, right? Same thing. The cells are hungry. They are tired. There is more sugar in the blood, but insulin is not able to open the door and serve you that food. That's why we have this fatigueness. The cells are tired. The cells are hungry. Unexplained weight loss. So when the glucose is not able to serve the purpose, whatever store that we have already in the form of fat, muscle, all that breaks down, which is leading to weight loss. Slow wound healing. I think a lot of you might like sweets, but if you keep say a rasgulla outside without refrigerating, within a day's time or 2 days time, can you see a fungus growth on it? Right? Sugar is a good medium for any bacteria to grow. Similarly, if people with diabetic or high sugars develop any wound, than the normal individual, if in 1 minute, than the normal individual, in 1 minute, 1,000 times the infection rate will increase in a diabetic individual. That's the reason they have a very slow wound healing capacity. Blurred vision, which is another problem which occurs for a diabetic individual is, see, our blood vessels in our body is so minute, like as thin as our hair, such a small tubercles. So imagine a blood has to run and pass through that blood vessels. It has to be really thin. I keep 2 glass. In one glass, I keep a sugar water. Another glass, I keep a sugar syrup and put 2 straws. For you to drink through the straw, sugar water is easy, but sugar syrup is very difficult, right? Similarly, when the blood sugar level is normal in your body, the blood can pass through easily throughout your system. But when the blood sugar level is thick, the blood becomes very thick, the viscosity increases. So the organs will not get the sufficient amount of blood supply to any of the organs. That is why the blurred vision can happen, and not only that, organs getting affected. To all of you, I wanted you to realize something. The real property that we have in our hand is our organs, not the car, not the flat, not a plot that you have, or not the gold that you have. The real organs that the real healthy property that we have is our internal organs, which is very difficult to be replaced. So for all our organs to stay healthy and active throughout your life, it has to have a proper blood supply and nourishments, right from vitamins to minerals to oxygen to everything it has to reach. That can be possible only when you keep your sugar levels under the control. If not, it can affect any part of your organ. I can't even say a single organ which can be safeguarded from diabetes. Where is blood in our body? Throughout the body, from head to toe, we have blood in our body. So when the blood sugar level increases, it can affect any part of your body. Right from the eyesight of an individual to the sex life of an individual, everything can get affected when the sugars are not controlled. It's high time we act upon understanding whether you have diabetes or not, you or your loved ones or family members, and understand and normalize and reverse the condition is very, very important. Right? So, how do we get this achieved? Lifestyle changes, which we all know, right? From our diet, exercise, weight, all that we should definitely concentrate and work on what is good for me, what is correct for me. You will have to check. That is what we call it as individualized approach. Not all the five fingers are same. Not every individual is the same. Every individual is different. So one exercise cannot be the same advice for another person. So we should have an individualized approach for every individual to handle these metabolic disorders. And it's not like one time I go get admitted in the hospital, I get my checkup done and I do all my tests done and I'm okay. No, it needs a close monitoring and a continuous monitoring. Right? So just it's like understanding you being healthy throughout your life. Right? Now, let's get into the next poll before I get into the advice. The serious part is over. Now, let's get into some learnings. At what age do you think people should start getting screened for diabetes? Good. The response is slightly low compared to the last polling. Can I have everyone have a good response towards it? Thank you for the few more additions. Great. Yes. So most of you have given an answer on say 20 to 25 years. Yes, very good, a right age. But at the age of 20 to 25, you monitor, do not stop there. I would suggest if you are normal, please ensure every 6 months once you are continuing this monitoring, not only for diabetes, other conditions like cholesterol level, liver function test, lipid level, that is your cholesterol level, thyroid. Keep tracking every 6 months once. And if at all you fall under some category of a pre-diabetic or a diabetic, ensure that every 3 months once you keep tracking. But if you fall under a pre-diabetic or a diabetic, you have to be on a regular monitoring. Let's understand that also. The 6 months period, I'm telling you are normal. You don't have any values to be on a higher side. Still to stay healthy and continue this range, you have to keep yourself monitoring. Thanks for this poll. Let's continue this. Now, we understand the role of nutrition, or say the role of food plays an important role in our health. So the diet, many things we speak about: balanced diet, nutrition intake. We should hydrate ourselves better, plan your meal in a better way. The snacks or small meals that you take should be very healthy. We should definitely concentrate on all that, right? But not all at a time. To start with, maybe one or the other habit that you can incorporate immediately after this meeting or after this session. Do develop one thing. Maybe in the chat you can put it across. What will be something, that one thing that you wanted to change? Maybe you avoid sugars. Maybe you pick up, instead of evening samosa, I pick up some other protein based snacks that I take. So some changes that you wanted to make a difference in your food habits, please place it in your chat. Let me come back and tell you on certain serious talks here, right? Uh, can you see these? This is a wild watermelon, and this is a watermelon that we get currently. And this was a wild peach that we were getting it long ago, but this is the peach that we are getting it now. I'm not sure whether watermelon, how many of you might have seen these, but definitely I have seen this. The wild peach from my childhood. I've lived in a hill station, so I could see a cloudy peach which I get and which I get from my trees, and I rub in my own dress, and it just goes away. That waxy skin moves out, and we consume it. Very, very small peachy peach you get, and very small flesh, but that will be very tasty also. But now you get an edible flesh count is high in a peach, but you know what? Sugar is also enhanced. To make us crave for it, there is an enhancement of sugar done in this in these fruits, right? From watermelon, peach, or your banana. The enhancements of sweetness is added in every of the fruit that we consume. So as the first poll says, it's not only about the sugar, that's a white sugar, brown sugar, jaggeries, honey. In any form, it's a sugar. But it's not only that we consume and it builds in our body as a sugar. It's all about these items also added. So it's very, very important we make our meal very personalized and take it. So why do we need to speak more about sugar here? You know what? As per the recent analysis, it's said that high consumption of added sugars is very, very associated with lot of health disorder, right from mental wellness to heart health to cancer. Everything gets affected when there is a higher sugar consumption by us. We have to be very, very conscious or cautious on the same. It's not only affecting the blood and leading to diabetes, it's affecting each and every organ functions. We have to be aware of that, right from your brain to kidneys to skin, glowing to aging to acne to everything plays a role because of the sugar consumption. So we have to be really very conscious on the same by having a personalized understanding of your nutrition and acting accordingly. Weight, all of us speak about the BMI, right? So BMI calculation is very, very easy. You can do it by yourself. It's simple, weight in kg by height in meters squared. And if your BMI is between less than 18.5, you're absolutely fine. The normal is between 18 to 25. Overweight above that is called as an overweight. But again, people who are into the bodybuilding aspects, you might have a higher BMI. Not all high BMI is a issue, but the muscle utilization, the distribution plays an important role, right? So the exercise that we commonly speak or everybody says walking is a very good exercise. Yes, I also agree to it, but not one form of exercise can help you. You should have a multiple other forms of exercise also incorporated in your day-to-day activities, like your muscle building activities, your resistance activities like stretching, yoga. All that also plays an important role in bringing up the glucose store or the distribution of your glucose and sustenance of your muscle health throughout your life. So it's so important that we concentrate on the exercise aspect equally along with the diet. Choose multiple forms of exercises, especially this high intensity exercise in this busy work schedule that all of you are in will give a lot of HIIT, high intensity exercise will give you a lot of results. Try doing certain things, small baby steps, try start taking in, because the muscle utilizing the glucose is very high, and it gives a longer results and a benefit for a longer period of time. Very, very important aspect. I think most of us will agree to it. We are not facing this. Early morning, 6 o'clock to 9 o'clock, sun raises. We should definitely get exposed to that sun rays. Not after 9, but before that, please ensure that you get a good sunlight exposure, because it's going to help many of your organs, right from your liver, preventing these metabolic disorders or controlling these metabolic disorders, thyroid functions, your kidney functions, your gut health, your bone health. Everything will be taken care when you get exposed to your vitamin D level. It's good to check your vitamin D levels also on a regular basis and see. Most of our Indians, we have less than 20 or 20 to 30 is the vitamin D level that we have, but it should be more than 40 to 50. Please remember that. And vitamin D is so important, right, for everybody. especially women, if you are pregnant, you should get exposed, your abdomen should get exposed to that sunlight in the early morning, not only for your health, even for the fetal health. Very, very important, right? Next, breathing. Breathing, I breathe every time. Now, as I speak to you, I breathe. That's different. Please have a regular breathing habit, breathing exercise habit that you have on a daily basis. Like nowadays, when you pick up a car, you guys pick a ventilated seats, a breathable seats, right? We so much concentrate on a car, our seat has to be very breathable for us to sit comfortably, right? Imagine you should ensure a breathing exercise is followed on a regular basis. Only then every small minute cells in our body have to breathe properly. We call it as cellular breathing. So this breathing exercise will help you in enhancing the cells inside our body, and the cells function will be very good. You can feel a difference when you start implementing this on your day-to-day basis. Small pranayams, some meditative breathings are there. It can be customized for your own health conditions also. Sleep. Before we talk about sleep, can we go for another poll? If people are sleeping, let them awake. Or yeah, we're going to talk about the sleep as well. Quickly around the poll. Yeah. So which of the factors actually affect or can be a cause of diabetes? Yes. Thanks for the poll. Do we have some more inputs?
As the people are putting in their answers, just a small request, Dr. Praveena, a lot of questions have come in.
Yeah.
So
So we'll quickly
let's,
finish.
yeah, we'll leave some time for the answers by you as
Yes.
well. So we'll try and wrap up.
Fine. Thank you. Yes, the answers are very much in line with the concept. Age was a factor initially, but as our lifestyle changes, it is causing the stress, lifestyle, genetics, everything plays an important role, or say a risk factors for developing diabetes. We should have a thanks for the clear understanding. I'm happy. Now coming to the major aspect of sleep. Sleep is something that's very, very important in all our lives, and it gives us a better feeling when you feel that yes, I had a good sleep today, and you feel so better on the day to run your throughout the day. That night sleep is very, very important. So ensure that you have a good sleep by following some simple techniques, by going hitting your bed a little early and avoiding your digital systems, digital lights for that basis, or incorporating some kind of herbal drinks that can support you in enhancing your sleep. Right now, we should very, very be, let us understand that initially we were talking about a very specific disease. Now we will have to look into a holistic approach to handle a element. So it's not about the single dietary aspect can help you prevent diabetes. No, it's a diet, it's activity, it's a stress level, your understanding, everything have to be looked into for your disorder to handle. Initially we were talking only a genetic factor can affect, but no, genetics plus our lifestyle is the cause for our disease condition. And initially the medicines approach were very generalized, but understand generalized treatment is no longer going to help us in reverse or normalize a condition. We definitely need a personalized approach to handle the lifestyle disorders, right? So we at Twin, we have, as in the introduction it was mentioned, we have developed this unique technology or unique patented technology, which is called as a whole body digital twin, which brings up like say a beautiful way of sensing our body signals. Close to in a day 3,000 plus body signals are collected from an individual, and based on the signal that your body is having, precise recommendations will be provided for you. right in terms of activity, medications, sleep, breathing, what time you have to do a good breathing exercise, what time of the day your activity can help in bringing a better results, what kind of a nourishment is required for you to handle your particular ailments, completely personalized by a AI driven technology, right? So it creates a very individualized plan for everybody. In fact, you can see a meal. Suppose I eat a roti and a dal versus my own brother eats a roti and the dal. The level that roti and the dal is going to create in my body is different from my brother's condition, right? So it tells to yield what ways you can control the levels to manage a sustained way. Our twin precisely tells you in supporting that advice for you, right? So we have been there in this system for the past 4 5 years, successfully transformed 27,000 people with our program benefited, and we are globally present in US and in India, successfully working towards marching towards making the global healthier and happier globe. Yes. Now over to the questions. Yes, Sana, we can start discussing.
Thank you, Dr. Praveena. So we have a lot of questions coming in. The first, now let me go in a chronological manner. The
Sure.
first question was caffeine and how does it affect sleep, and does it have an impact on any of these chronic metabolic diseases?
Yeah. So the caffeine, it opens up the dopamine effect in our body. So yes, but dopamine effect, you can think it's a kind of a you are addicted towards a drug. Similar effect is what the caffeine is also, and it keeps your brain functions a little more active, but it cannot help always, right? The time your brain needs a rest during the sleep, it's very important. So this dopamine effect can be replaced by a 10 minutes of HIIT exercise within your daily corporate life. A simple jumping jacks for 3 minutes can give you the similar caffeine effect. You can try that out.
Yeah. And also, all these kind of things, one should put a limit on those. That is up, upon you, that how much excess of anything is bad. Even water. If you have excess water, it will wash away all the vitamins and nutrients inside of your body, and it can lead to swelling also. Anyway, so Sriram Gupta has a next question. He said, what should be the number of steps for somebody with a vitamin D of 7.5? Now, I'm not too sure about the units because 7.5 as per the standard units of measurement seems to be very low, but let's assume here somebody has a low vitamin D, so should that person be walking, and if so, how many steps?
Yeah. So walking, yes, you can continue, but this low level of vitamin can be addressed only by external supplements. Unfortunately, the building up of vitamin D, storage of vitamin D can happen only when you have some amount of storage already there in the body. So it's good to get a consultation with a physician and start on certain supplements to support your vitamin D boost, because as you walk, the your bone health is also important. I would equally say you handle your walk. 5,000 to 6,000 step is good for an healthy individual. But I would also like to know more of details about your height, weight, your other activities that you do. All that matters. But for this vitamin D specifically, you definitely need to have a supplement.
Uh,
Need,
can,
yeah.
Thank you. Can I step in? I mean, can I give
Sure.
some?
Sure.
Okay. So I'm 34 years old and a weight of 61, a height of 5 feet 7 inch. So I'm a marathon runner. I have had 4 half marathons so far, and I'm competing for 1 marathon. So on the exercise part, I have been doing it pretty good. It just like uh, I do uh, I do take up the half yearly tests, and in that only I noticed my vitamin D is very low.
You definitely need to have a supplement, sir, with
Okay.
such low level.
Okay, sure. Thank you so much.
And it's not like a single tablet, it's a course of drug. Like say
Mhm.
weekly once it will be prescribed for 8 weeks, 12 weeks, depending upon that, you will have to take that.
Okay, and in addition to the external supplement, is there anything I need to change in my dietary habits?
Yes, again, as I was telling you earlier, it has to be very personalized with a lot of inputs from your food habits and things have to be incorporated before I prescribe you something.
Okay. Understand.
Yeah.
Thanks.
In short, replacement for vitamin D is available in very, very low levels in the day-to-day food items that we have. So if you're not stepping out a lot, the best way to do is to do a course of vitamin D, as Dr. Praveena suggested. And I think everybody, at some point has been or will be deficient in vitamin D. So better to keep a check on your levels and to consult your doctor about how to cover up for that. Um, this is a very common question. Is honey a good replacement for artificial sugar? In a sense, is any form of natural sugar better than really having processed sugar, or does the effect of both remain the same on a person suffering from diabetes?
So very good question, a common question being asked in most of the forum. Yes, the sugars, everything gives you the same calorie levels, be it honey, be it jaggery, be it brown sugars, everything gives you the same effect in our body. Eliminating any form of sugars for a diabetic individual is always good. But when you ask me a replacement, there are synthetic products mostly available, which I wouldn't recommend mostly. There are non-synthetic products also available, like stevia, all that non-synthetic products are available, but try to learn sugars without the sweetness. It is actually very nice. Enjoy the products that have a natural sweetness, like your cinnamon powder. Cinnamon powder has a small, mild sweetness in it, adding on to some of your drinks that really help you. Try maximum avoiding the sweetness.
Thank you, Himanshu, for that wonderful question. Basically, if you guys have been reading, stuff which has come out about sugars, sugar is the new cigarettes, they say. So it's as harmful as having, cigarettes, in fact, sugar. So try and avoid it in natural or artificial forms. Tina says she's finding it very difficult to lose weight because she is a hypothyroid. She's a case of hypothyroidism and she also has surgical menopause. So, doctor, what would you suggest?
Yeah. So again, I missed the name. Yes. So it has to be
Tina.
worked out. Yeah, it has to be worked out very personally by understanding right from the cellular level of your body condition, right? So what is impacting on stopping you, or which plateau level that you have achieved in weight loss, and from there why you're not able to do it. We will have to look into multiple things. We will have to look into your resistance level in your body, right? From insulin resistance, your cellular resistance, the sensitivity that your body cells accepting the storage of glucose instead of storing it as a fat, why that is happening. We have to understand in a cellular level to bring things normalize for you.
Right. Right. So two questions, I'm going to club them together from Mahima and Ganesh. So both are asking about type 1 diabetes. Ganesh has had it since 4 to 5 years. And is insulin, does insulin continue for life in type 1 diabetes? And, what are the suggestions Ganesh is asking? Because he's very young, only 22.
Yeah. Yes. So I would say he's a great warrior of life, and brave people. Type 1 individuals are really brave. Yes, insulin is your best friend. For type 1 children or people, please understand insulin is your best friend. Have them always with you. They can really help in supporting your health throughout. But yes, through certain technology, even in Twin, we support type 1 individual to manage their sugar levels with depending on insulin, how efficiently they can manage, and we can ensure that the insulin dosage does not increase. But yes, your answer to answer your question precisely, yes, you have to be dependent on diabetes throughout your life, and insulin is the best friend. You know what, that is the safest drug. If women during pregnancy, the drugs will be very, very crucial in considering, right? Like we think of adverse effects, we think of certain side effects that comes while prescribing a drug. Now insulin is one of the safest drug which has no side effects. Please do understand, in the only side effects that insulin can have is uh, if we don't follow the right insulin injection techniques, we might have an issue. So we can support you in educating the way that you're injecting your insulin and handle. That's the only issue that can come up, but I don't see any other challenges being on insulin. It's a good friend of yours. Please do continue for type 1.
Ma'am,
Yes, please
can I,
go ahead.
After shifts, I go to home and then I feel very, very tired. I'm just going and sleeping all
Yeah.
over the
Huh.
house
How
Yeah.
many
till
hours of work? And are you talking about day shift or are you talking about night
yeah,
shift?
yeah, general shift of for 9 hours.
General shift. Okay.
Yeah,
So basically, you're feeling tired.
Mm.
yeah,
We understand, Ganesh. We will have to work personalized again for you, especially on your nutrition intake, right?
Yeah.
So the tiredness is one of the major factor that comes up for a type 1 individual. We will have to work on your food that will give you a prolonged release of glucose throughout your working time, right? So there are food that will give immediate glucose response. There are food that will give a sustained release of glucose. So we will have to work with you in helping you out in giving that sustained release of energy. Which food is going to give you? Opt for that and consume that. So you will feel energetic throughout the day. We will have to work with you, Ganesh.
Right. So just to reiterate, everybody, there are now solutions with the use of artificial intelligence that are actually successful in completely eliminating medicine for all chronic conditions. So that's where we are, Dr. Praveena is stressing on individualized and very, very personalized and precision, treatment and the path that we have to move forward because everybody is different. So like you said, you're tired. It could be due to many, many reasons, right? From a deficiency in vitamin D to maybe your nutrition not, being up to the mark. Maybe you're not getting quality sleep. So we'll have to really talk to you to understand. So please feel free to reach out to us through, Pinkasha. Take our contact details if you're interested, and we can have a free one-on-one session with you guys according to the time that is convenient to you. Priyanshi and Raksha, I'm going to try and answer these questions. Jaggery better or harmful? So the answer is any sort of sugar, be it natural or processed, is going to add to the fact that your cells will start aging. Sugar is not good for the system. But anyway, jaggery is the lesser evil out of the two because it's not processed, right? Priyanshi's father is diabetic since the last 5 years. He's very physically active, not overweight, and has good sleep, no fast food. Wonder why his sugar levels are so high. So, one reason, like I said, could be many reasons, could be stress, right? Dr. Praveena, can you take this
Yes.
one?
Yes. So as we were discussing, the metabolic disorder is not only about the activity and the nutrition intake. It's about the breathing, stress level that we have, cellular level understanding. What is the insulin production in your body and how the insulin acting in your acting in your father's body. We will have to definitely understand, right? So that level is so important. That tests are mostly not done in many of the practices. So it's called as a HOMA 2B, that is a level of insulin produced in your body. And HOMA 2R is a resistance. How what is the percentage of resistance that's there where the cells are not accepting the glucose, understanding that cause. There is something called as a sensitivity, which means the need. There should be the need for glucose to uptake, so that craveness from the cells, why is it lacking? We have to understand from the cellular level. Only when we do that, it's very, very possible to get back to normalize. We at our practice at Twin, we have eliminated insulin for type 2 diabetes individual. People come up with 3 drugs to 7 drugs also. We have eliminated medications for them. A great thing is people come up with in kidney failure, there are different stages: 1, 2, 3, 4, 5. So we have brought back the third stage of kidney failure also towards a normalized condition. So the success elements are a lot, but we have to work on the cellular level.
Right. Thank you, Dr. Praveena.
So
Himanshu,
I
thanks for
just
being
have a
very
doubt.
participative. Apart from fatigue, which is not very common because every corporate employee is fatigued, any other symptoms that can raise alarm about the development of pre-diabetic condition? Now, since you've used the word pre-diabetic, that means that the situation has not reached the alarming level. So in this situation, I think Dr. Praveena will agree that a blood test every 6 months or a normal random blood sugar test should give you an idea. But if the situation gets out of hand and let's say you've crossed that pre-diabetic condition and you are diabetic, the most common symptom that people experience is feeling thirsty excessively. That is one thing. Am I right, Dr. Praveena? Please add to
Yes.
this.
Yes. When the sugar levels cross more than 160, 170 in our body, the kidney tends to eliminate the sugars from our body in the form of fluid, that is our urine, and sugars are eliminated. So not only the feeling thirsty, people might get infections in the groin areas. So vaginal infection, penile infections, because of over sugar transforming, and you can't keep the throat at office always having a hygiene maintained. So what happens, the sugar there in our private areas, it can cause infections. So many people end up in clinic for a complaint of urinary tract infection or penile infections or sexual disorders. That time we pick up the real cause for this is diabetes.
Right. And also frequent urination is one such symptom that one might experience. How do I increase magnesium levels in blood naturally? Prasenjit is asking because magnesium is important, a key in our metabolism. And should you be avoiding tea and coffee to increase the magnesium levels?
Again, so see, if you're again, since it's not that I'm with twin, I'm talking about this. Uh, uh, our micronutrients plays an important role in our body function, like how a car fuel, like your petrol or a diesel or a gasoline is a major source. Your other oils plays an important role for your engine functions. Similarly, the macronutrients like carbs, protein, and fat are important for our body functions, but these micronutrients play an important role in the cellular functions and active organ health. The magnesium plays a very important role in our metabolism. But again, which food is helping you in the absorption of magnesium, we have to analyze it. Okay, so say if you're taking a simple tomato has a good amount of potassium, but how much of potassium your body is absorbing, we have to do a cellular analysis. So which food is supporting you in the absorption, we have to understand it. There are
Okay.
a lot of foods that has magnesium, but which is supporting you, I have to understand personally.
Right. We have, I think, the last question before we end. Okay. Priyanshi asked, what should be the frequency for sugar check for a diabetic? And Priyanshu asked, since diabetes is a dietary disease, can we control type 2 diabetes through proper diet and exercise to the point where medication is no longer necessary? Also, should you be buying a CGM instead of pricking daily? Very good questions.
Yeah, very good question. So let me answer the second one first. Yes, very, very possible to prevent by having a right modifications for your health. Personalized right modifications will definitely help you in prevention of any chronic metabolic conditions. Answering to the first question, which is about come again, Sana. The first one was on
What should be the frequency of sugar
frequency of
checks?
monitoring. If you ask me, it should be on a daily basis. Daily basis of monitoring, but unfortunately, it's not possible to prick ourselves through the fingers on daily basis.
So the CGM patch is very effective in
CGM
that.
patches are very effective in a way, but again, say CGM, it captures 96 readings in a day. Every 15 minutes, it captures a reading. But again, just by knowing the reading, we will not be able to do it. How are we correlating the same with other factors like your activity, your sleep, your food, which food is increasing, which activity is supporting? All that have to be correlated and understood. That's why you need a support of whole body digital technology to get that answered. But yes, if to be very frank, as per the guidelines, it is 3 months once you have to monitor your HbA1c, and everyday monitoring of sugars plays an important role.
With the CGM, I guess it'll only help you. Maybe you wear one CGM patch or two to know the pattern. What time your blood sugar is rising, what time is it falling, after which food, if you have a regular food pattern, after which food, breakfast, lunch, or what is the food item that is actually giving a spike. Maybe one day you have tea with sugar, the other day you try without sugar. You cut down on bread, then you'll see that your sugar levels will fall down. So it really will be a hit and trial method, and it won't give you any solutions. It'll only make you aware of what the problem is. So thank you. Pooja has a question. She's saying, why should the creatinine level be greater than 4 for a CKD patient, and assuming that the person is also diabetic? What is the reason for the increased creatinine levels?
So the creatinine level for all of us should, the normal creatinine level should be less than 1. See, creatinine is a waste element. So it's a byproduct, or say a end product of protein metabolism or your muscle usage. Now, the creatinine is a waste that has to be eliminated through urine. When the kidney is not functioning properly, the creatinine, that is a waste in the blood, waste in the body gets deposited in the blood. That's why the creatinine level is increasing. So for all of us, we should have the waste eliminated in the urine. But for the individual where the creatinine level is increasing, which means the kidney functions are deteriorating, it is not eliminating the waste from our body. Instead of removing out, it is getting increased in the blood. So that individual who has a high creatinine level should immediately get into a very close intervention to safeguard the kidneys. Kidneys, when I say, many people have a question, is my both kidneys have a problem? Yes, this creatinine high can happen only when both of your kidneys have lost its functioning ability. So it's so important that we get into an immediate care. Creatinine level high is not good. You have to get into a treatment immediately.
Right. What food can be taken to lower creatinine levels?
Again, as I told you, you have to be very, very personalized. It should
Yeah,
monitored very closely.
absolutely. Even the amount of water, how many mLs of water you're having, how much protein
Salt
you're
intake, to
having,
everything have to be
all
considered.
of that can affect individually or together. So it is really depends from person to person. There is no one answer for this question, I'm afraid. So to put things in perspective, the question of CGM, see, CGM is used to get data. What you do with that data really is, makes all the difference. So for instance, we collect data points to create a digital twin, and that really helps in eliminating the root cause, which is your dysfunctional metabolism. If you generally want to use, and you have so many people on Instagram making reels, how much spike does my sugar have when I eat cake, or how much spike does it have when I eat pasta, all that is really pointless at the end of the day. So using technology and making the best use of it is something which we should do, rather than just wasting money or just doing something which is gimmicky. That won't help, because we're talking about a very, very serious condition over here, which which is possibly life threatening as well if it advances. Now I think we'll take the last question. What is the process for one-on-one conversation with doctor for diet and exercise guidance? So what we'll do is we're going to leave our contact details here with the team, with PASCare team. And if any of you are interested, either we'll collect your, coordinates, or you connect with us. We'll try and figure out a way to create that connect. So I think Ganesh is interested. How to explain more on what is digital replica and how does it help tracking and other markers? Himanshu, I think we'll need to connect on a separate call. So let us know when you have time. How should we do this? Team PASCare will be able to help us actually. Pinkasha, what would you suggest? Like, will you be getting in touch with these people who have questions for us which are very specific?
Oh.
Or, yeah,
So
please
I
suggest.
think one way to do this is just send a quick Google form with the details of people and
Hmm.
let them put in their questions. The same form can be shared with you. If you want me to take some more details, like what time are you available, I can even take that, and your team can then reach out to them. Will that work? Yeah. Okay. So I'm going to do that.
Add a contact detail in the Zoom chat. You can have a track of that also. Mahesh, we wanted to add on that.
Yeah, if people are sharing it here, let me take it from here. But if not, then let's share a Google form right after the webinar to everybody. And please fill that and get in touch with the Twin Health team.
Yeah. I've anyway put down my email address, and I'll connect you to the right person in our team, be it a counselor or a doctor, whatever you need at that point, and we'll try and sort this out for you. But thank you so much, Pinkasha. Thank you, Dr. Praveena. That was so informative and very timely indeed as well. So, Team PasCare, congratulations for taking care of the people that you're working with. And yeah, it was a great experience. Thank you to all my
I
team,
would
Phil,
appreciate the
Desh,
entire
Praveena.
crowd. It's not only about they think about themselves, they think loud about their family ones and the loved ones and asking
Yeah,
questions. It's great. We would like to extend our support to all of you.
yeah. Thank you.
Thank
Thank
you
you.
so much, Dr. Praveena. Thank you, Sana. Thanks everybody for taking out the time today.
Bye.
Bye.
Thank you.